Hello, I'm Dr. Michael Brandt-Sawatsky, Senior Physician Executive at Hoag Hospital, and I'm privileged to have two of our leaders in the Salisbury Parkinson's and Movement Disorders program to discuss an interesting condition, a disease that is increasingly affecting our senior population and obviously those that care for them. Dr. Mindy Bixby, Dr. Selena Schaefer, privileged to have you here this morning.
Thank you so much.
So I'm going to start with a question, and I'll ask Mindy first. Mindy, tell me, what is Parkinson's and why is it difficult to pick up in the early stages?
Parkinson's disease is a movement disorder that can affect our bodies from moving and having tremor and ultimately stiffness and slowness.
Mindy, most people think of Parkinson's as a disease that causes tremor, yet that's not always the case. In fact, commonly the early symptoms may not even be tremor, and so it's hard to pick up. Tell us about that.
That is correct. You may feel stiff or slow, and it may be a normal aging process, but sometimes it can be Parkinson's disease.
And what causes it?
A dopamine deficiency. So a dopamine deficiency in your brain, which is a lack of a neurotransmitter.
What's a neurotransmitter?
Great question. It's a signaling process in your brain that allows your body to move and think and see. We have a lot of neurotransmitters in our body, and ultimately dopamine is one that actually helps us with motor symptoms and non-motor symptoms.
So it's a chemical, kind of like insulin in the pancreas that keeps our blood sugar steady. Dopamine is a chemical in our brains that communicates impulses between our nerve cells that allow us to have smooth motion. So if I'm suddenly waking up and feeling that I have trouble starting to walk, is it my arthritis or is it my Parkinson's?
If you don't know how to detect the symptoms of Parkinson's, it may be difficult for us to differentiate between normal feelings of arthritis or not sleeping well compared to a dopamine deficiency.
I guess that's why we need experts like the two of you. I want to pick up on this theme a little bit with you, Selena. So when people think of Parkinson's, they see Muhammad Ali or Michael J. Fox, two extremes, one being motor robotic-like, shuffling gait, stiff, barely able to speak, expressionless face, whereas Michael J. Fox seems overly animated. He's twitching, he is moving. Why the big difference, and is that the typical picture of Parkinson's?
The age-old statement is that if you've seen one Parkinson's person, you've seen one Parkinson's person. The symptoms vary throughout.
And so when people hear that word, though, they visualize those two individuals, unless they're much younger, but for the older set, like myself, that's what comes to mind. Yet many people, maybe most people, live their lives very differently than is demonstrated by those two individuals. So give me an example of the typical Parkinson's patient that you see in your office and what their life is like.
Many of my people that I see, you wouldn't know that they have Parkinson's except that they're in my clinic. They live a normal life. It's a little bit harder for them. They maybe walk a little slower, move a little bit different, maybe have a tremor. But other than that, they can live a normal life.
I know that some folks have trouble with voice control, with buttoning their buttons. Why is that?
Going back to that neurotransmitter dopamine, dopamine controls, it allows our muscles to control smoothness of movement. And so if we lack dopamine, that causes us to have that decreased ability to move finely, which is where the difficulty buttoning, perhaps difficulty brushing your teeth, brushing your hair, or even voice.